Hypermobility EDS is a subclass of Ehlers Danlos Syndrome where individuals have joint hypermobility as their predominant symptom. They may have some soft skin, and the skin may be mildly stretchy. However, they do not usually have skin fragility. That means that their wounds will heal. They don't have unusual scarring. They do not have their wounds open up after they've healed. So a main criteria of the hypermobility form of EDS is that their skin usually is intact. The vast majority of these patients have difficulties with joints, particularly pain and joint dislocation and or subluxation, meaning that they have the sensation that their joints are popping in and out of place. These individuals can also have other concerns outside of the joint pain. These would include GI problems. Irritable bowel syndrome is very common. Heartburn is very common. These individuals do have issues with mood due to pain. They can have anxiety and depression, but sometimes these patients can be predisposed to depression and anxiety even without the pain. Hypermobility form of Ehlers Danlos Syndrome is diagnosed by clinical exam. You need to rule out any signs on physical exam that may make you think of other subtypes of Ehlers Danlos Syndrome. And very detailed family history is required to make sure that there's no history of unexplained vascular events in the family that may lead you to think of other forms of Ehlers Danlos Syndrome. But the primary way it's diagnosed is by physical exam. This is a lifelong condition. You cannot correct or change the hypermobility or the symptoms. You can only manage them as best as you can. These would include ways to improve core muscle strengthening and avoid the dislocations and subluxation that can occur in these individuals, as well as pain management. Many of these patients can have significant pain. It can be quite debilitating, and pain management is a priority in these patients for long-term function and quality of life. So Ehlers Danlos Syndrome is an autosomal dominant condition, meaning that you only need one change in one of the two copies of genes you have to have symptoms of this disorder. Patients who are first-degree relatives, mom, dad, or siblings, and children are at a 50% risk. So if the individual has Ehlers Danlos Syndrome, should have children, their kids would have a 50% chance of receiving the gene that leads to Ehlers Danlos Syndrome and having symptoms similar to their parents. When we are treating patients with Ehlers Danlos Syndrome hypermobility type, they will usually be evaluated by physical medicine rehabilitation for core muscle strengthening and long-term management. We also try to have our patients see pain rehabilitation because the pain management is a long-term goal, and it can be quite significant for these patients. In some cases, if they're young and have severe scoliosis, we may refer them to orthopedic surgery as well. But the vast majority of patients who have Ehlers Danlos Syndrome hypermobility type, orthopedic intervention does not have as good outcomes as other individuals. They tend to have problems shortly after their surgical procedure, and their joints may actually be just as loose as they used to be.